set the tone Hello. Hello.
Hillard, we're live.
Okay, people can hear me?
Yes.
Yeah, good idea. I'm here, not there, I'm just sick. So, I apologize, timing wise, that's all. Nothing serious, but just coughing all over the place. Anyway, welcome to the March 6th, 2023 meeting of the Yarmouth Board of Health. I'm Hillard Bosky, one of the board members, and just for the record, this is a hybrid participation meeting. So if people want to join, the instructions are on the website, how to either call in and listen or to actually be visible on the meeting here. The first item on the agenda here is public comment. Actually, it should be attendance tonight. Mary, are you present?
Present.
Okay, I can do a little work on the volume here for myself. Deborah,
Present.
Eric,
Present.
Charlie,
Present.
great, full house. That's great. Okay, let's go on to the public comment. Do we have anyone calling in or in the room who'd like to come forward with questions, comments, or whatever?
No one in the room.
Okay. Anyone waiting who's called in? Anyone there?
No, no one's called in, no one in the room.
Okay, let's go forward then. Next is a discussion of the Cape Cod White Ribbon Day. Director Murphy, what's up?
This is the annual working with White Ribbon Day. We have a representative from Independence House to go over the presentation for the board.
Great, just please come forward there, have a seat, and just introduce yourself. I have my white ribbon on today.
Good afternoon. My name is Bob Ravenel, here as a representative for Independence House. I want to first thank you for having us here, especially Director Murphy, for your support. If you're not familiar with White Ribbon Day, it began back in 1991 after a tragedy in 1989 that occurred in Canada, where a number of women were killed by a gunman. A group of pro-feminists started this day, and it has been an international event. Here in Massachusetts, Jane Doe Inc., of which is a coalition that we belong to, began White Ribbon back in 2007. And last year celebrated their 15th year of this. Here on Cape Cod, we've had the good fortune of working with Yarmouth Police, as well as the Cape and Islands DA for the White Ribbon Campaign. In the past, we've been doing this for 10 years now. For the past, it was just a day that we did, and people came for a couple of hours. But last year we did remote sessions, and we had 3 panels: an education panel, a healthcare panel, education panel, and first responders panel. This year, we've expanded that. We're doing live events. We have 4 of them. The first one is tomorrow night in Wellfleet. And there you'll see we have Dr. Gordon from the Sheriff's Department and Chief McDonald from the Orleans Police Department. Then next week we have in Falmouth, we have Judge Kirkman and Peter Sessa, who is an attorney at law. And then right here in Yarmouth at the Cultural Center, and we're really excited to have D.A. Galabois and Michael Patterson, who will be facilitating the conversation. And then we'll finish up at 4Cs with Danny Rodriguez and Ross Jackula, who is the coach at the football coach at Barnstable High School. This is an exciting time. We're excited because what we'll be doing is having conversations. And the idea really is to have men talk about how we can address the issue of violence against women. The vast majority of violence that occurs is men against women. Doesn't mean it doesn't happen amongst others, but that is the vast majority. And what we're going to be looking to do is have that conversation about thoughts and ideas of how we can address that. And then at the end of the event, have people take a pledge. One of the things we will ask them, we are doing a poll everywhere, asking them to commit to doing something over the course of the year, and whether that be take a bystander intervention course, whether they advocate for women in whatever environment they work or live. We're going to ask them to walk away with a commitment for us and to support women. So as always, we want to thank the town of Yarmouth for your support, both for this and beyond, and also especially for Director Murphy, who has been a strong supporter and advocate for Independence House and all of the work that we've done. We've really appreciated that support over the years. Any questions anyone have?
Do people have to sign? It does say suggested RSVP.
It's suggested, but people are more than happy to show up. Last year when we did this, we had one live event. We had a small at the cultural center. We're anticipating a much larger group this year, but people can certainly just show up, and it'll be about an hour and a half session.
And how have you advertised it?
We've advertised it just about everywhere on our websites. We've also, Chief McDonald sent it out to all of the chiefs to put out there. So we've actually tried to really engage the first responders, the police and the fire departments. So we've advertised through there, through the libraries in the different towns. We've sent information out to all of them.
Great.
Thank you. Any other questions?
Is the best place for the community of folks listening at home
Yeah.
to go to Independence House website, or what's the website that they would go to?
Yes, they can go to independencehouse.org and they'll see events, and they'll be able to see the flyer there, as well as every Tuesday, the events that will be happening.
Wonderful.
Thank you.
You know, a pillar of public health and for the board is prevention, right? That's if we can predict it, we can prevent it to be upstream of a concern. So just the fact that you're raising awareness, and how many years now has this been going on?
We've been doing it on Cape for 10 years.
10 years.
But
Mark.
it's been going on much longer than that. And what we really like about what we're doing now is it's not just preaching or giving this information. What we're trying to do is engage in a conversation, because we think that's how people will, something will strike them. They'll learn from each other, and that's the whole process.
Right, that emotional connection. right,
Exactly.
To be able to engage. Public health in this issue, you have to participate, you have to be engaged, and that's the measure of success. So
Exactly. Yeah.
wonderful.
Thank you.
Thank you for being here.
Thank you.
Anyone else?
I think the next time we might see him is in the fall, when it's Domestic Violence Awareness Month. We usually have you come in again when we switch to purple ribbons.
Yes, yes. There are a lot of different months, but yes, that is when we do our breakfast.
Yes, you do the breakfast that we've gone to. That's very moving, and we've invited board members in the past. And I think he had Chris Morris come in and brought some of the silhouette statues and made a presentation that night. So
Yeah.
that might be the next one in the fall.
One of the things we're working on as a goal is we'd like to have a men's conference. And it would be maybe a 3-hour half-day conference. Again, where we could have men come in with hopefully a keynote, but be able to have these conversations, because quite candidly, what we find is that people aren't able to have these conversations regularly. You're busy with your day-to-day life, with work, with school, with all these different things, and you don't have this time. So we want to try to create more environments where people can have these conversations with each other. So,
Good. And I think we put on our public health electronic signboard on 28, White Ribbon Month. If you need services, call Independence House. So that will be up there last week and we'll leave it up there.
Thank you.
This week.
Thank you so much.
Good.
All right. Thank you all. Hope
Thank
you have a
you.
good evening.
Thank you.
Okay, thank you very much for coming in and your efforts here. Okay. Next item on the agenda is the Yarmouth Substance Awareness Committee. Director Murphy, just want to bring us up to date there. Thank you.
Defer to Jay for this one.
Sure.
Okay, great.
Mr. Chairman, the representatives for WISAC said they could not be here until 6 o'clock, so we need probably another 15 minutes before Annie Catalano and Daniel Rodriguez will be able to come and speak to that. But if we can just move to perhaps another agenda item until that time.
Okay, don't just let me know when someone comes in there. That's
Will.
the view of the room changes, so I'm not always able to see everyone in the room there for sure. Okay, the fourth item here on the agenda is a hearing for 7 Crescent Court, South Yarmouth, and that's for a septic system repair. Just for the record, I didn't have a map in the package, and so I didn't go over and do a site visit. I'm not sure what people had. So I had spoken with Director Murphy about this, and we agreed we can at least start the process on at least listening to, I guess, the variances that are going to be or are requested. So is there someone there who can come forward and present?
Mr. Chairman, Asa Mintz is here, the engineer, AJM site design, and he's here to give a presentation.
Great.
Do you have interest in me putting up the plan or do you?
We have it here in the plans, and the plan will come up as well. And some pictures.
Nobody uses easels anymore.
Thank you much.
Did all the rebutters respond?
I've got 4 out of the 7.
Okay. And the ones that didn't, which were,
I don't know them off the top of my head, to be
Okay.
honest with you. But that's what I got back. I only got back 4 out of the 7, so.
We'll get the list. Let's
Asa
go for
Mintz, AJM Site Design for the record. Representing the applicant, Roy Gardner. Yep, this is the property we're looking at here. It's an existing 4-bedroom. It abuts Kroll's Pond, the upper end of Kroll's Pond. It's a 1-acre lot, but it's a tight lot. And we've got, like I said, existing 4-bedroom. That is sort of the location of the leach field in the back of the property, which is in failure at this point. It's a 1,000-gallon tank and a pipe and stone leach field, which has solids carryover, Orangeburg pipe, and it's currently in failure. So access around the back is incredibly tight. That's a 10 scale drawing, so it doesn't really do it justice. If you're out of the site, you get everything around getting anything around the back is going to be difficult. So we chose to put everything in the front. This is a system, the proposed system's a 1,000-gallon tank, or a 1,500-gallon tank, 1,000-gallon pump chamber, and a pressure distribution leach field, a pipe and stone leach field. And getting, putting these components in the back, you probably have to use a trench box to set the tanks. Just going to be very, very difficult. We're going to be up to the edge of the wetland, if not in it, trying to get around back. So that's why we kept it around front. But the leach field is about 54 feet from the edge of the wetland. The tanks are about 74 feet. And we are looking for a 1-foot variance to groundwater for a total separation of 4, primarily to keep the aesthetics of the house, kind of proper. The front of the house is mounded a little bit right now. And we're still with the 1-foot variance, we are bringing grade up. I don't know if you can see the yellow ribbons. The lower yellow ribbon, it would be finished grade. So we're coming up like maybe a foot, maybe a little bit more, but we have the benefit of having a lot of exposed foundation there. So what we can do is just put some window wells in and grade up to the foundation and still have you know, the proper drainage. The finished grade is about the top step of that landing right there. So, as you can see, if we go much higher than that, it's gonna be above the threshold. So, we were trying to kind of make it work with grades on this one. Like I said, it's just real tight. We've got the leach field as far from the wetland as possible. Groundwater, so this is a tidally influenced area. This particular area, it's probably about 750 feet between Crowell's Pond and Bass River. So we put a groundwater well in to watch the groundwater over the course of about a month. And we determined our high groundwater that way. And you know, we did prove that it is in fact tidally influenced. So we, that's about it. I would be happy to answer any questions you may have.
Could you just explain to the board the two variances that you're requesting?
So the first variance is the distance to the wetland. So we are inside of the 100-foot buffer. This whole property is inside of the 100-foot buffer. So we would like to go from 100-foot separation down to 54 feet, primarily just because that's the only room that we have. And the other variance is the 1-foot separation to ground, or the 4-foot separation to groundwater. We're looking for a variance from 5 down to 4, which will help make this project work a little bit better.
Mary, if it's okay with you, I may have you take us through this. I can just tell you the pictures of the house are fine. But the map that was put up, on the computer screen, you really can't make out anything. So if you feel comfortable with it, maybe you could lead us through this.
I'm only seeing a side view where the leach field is. It doesn't really extend out to the property in the back. Is there another picture that you have that you can show us? I mean, what are beyond the decking there and with the leach field in front of it? What is that back there?
So that back there is the salt marsh that is the upper end of Crowell's Pond. That is the backyard. And we're actually, the only thing we're doing in the backyard is actually going to pick up the sewer line that comes out of the house, and we're going to run it around the front of the house so we can do the work. If you go back to the other picture, that one, that's where the leach field will be going. That oak tree is going to have to come down, and the leach field is going to extend just out beyond the horseshoe. There's that small evergreen there. You can see a stake just below that evergreen. That's the corner of the leach field. So that leach field is going to extend all the way across the front of the house there. And it's just, like I said, this whole site is within the 100-foot buffer. It's a 1-acre site, but there's not a whole lot of upland to work with.
I do not know what window wells are.
So window wells, because to gain that separation to groundwater, we're going to bring the grade up. That driveway is going to go away. That's no longer going to be a driveway. The driveway is actually going to be on the side, closer to that evergreen. We're going to bring the elevation of the grade up, and we're going to grade it against the foundation. And what window wells are just semicircles that you put up against the window that just retain the soil
Right.
back.
Oh, okay.
So
Just regular window.
That's all it is.
Not a specific septic.
No, it's not a technical term.
The pump chambers are going to be to the left, kind of where that orange stake is.
Yep, the pump chamber and the septic tank are going to go, I think actually that stake that you can see that's closest to that one right there is actually the end of the pump chamber. And the other stake, I think you can just see it off of just see the very edge of it is actually the other side of the septic tank, right there. Yep.
Is this a 4-season home or is this a summer?
It is, well, it's going through a real estate transfer right now, so I don't know what the intent of the buyer is, but it is a second home to somebody right now, but it is certainly capable of being a year-round home, without a doubt. It's not like, it's a year-round home.
Is there a floor plan there for the board to look at of the house?
There's a floor plan on the plan there.
There is a plan right on the, there's a floor plan on the engineer design plan.
Very small.
Yeah, it's assessed as a 4-bedroom, and it is a true 4-bedroom. There's no, a lot of the times you'll find an office or something like that is called otherwise, but this is a true 4-bedroom.
You have your biggest scale there. They said that you can show them that you have with you.
What's that?
You have a bigger plan,
Oh, I do. Yeah, yeah.
the site plan that you could just hold up for them. Right behind you.
What, is there anything-
Yeah, just hold the mic in front of you, then just point out where the rooms are. Maybe you could pass that by to the board. Yeah, that should come right off.
So, we've got this up here real quick. It's a split level. It's like a raised ranch, right? So we've got upstairs, we've got an open living room, dining room set up with a kitchen. And then we've got 3 bedrooms down the hall in the back with a bath. And then downstairs, we have another living room that's all open to the stairwell, a closet, a utility room, which actually holds an ejector pump. And then another bedroom and a bathroom down in the basement.
You said that the, you were going to reroute the, what is it, the discharge around the building?
Yeah, so the discharge is in the back here.
Okay.
And it goes into this septic tank and into this leach field right now, but because access is so difficult around this corner, we're gonna bring the plumbing right around the outside with a clean out and into the septic tank in the front.
Okay.
Just better access.
Looked like there was maybe a gas line over on that other side as well, where the driveway is.
Yeah, the gas line is not so much an issue. The water line is an issue. The water line, as it sits right now, goes right through the middle of the proposed leach field. So that's gonna have to be rerouted to, 10 feet from the leach field, but we do have room to get that, squeeze it around there.
It's really tight. I took a ride by and it's,
There are not too many options out here, so.
So what happens to the existing leach field?
The existing leach field will just be abandoned. This tank will be backfilled. So when they come in to dig this trench line around here, they can just open this tank and backfill it, put the lids back on it, and that'll secure it.
Lisa, have you brought this in front of the Conservation Commission yet?
Conservation's seen this and they've signed off on it at this point, so they were fine with it.
So it appears from having the opportunity to look at the site plan, that the new system will be a little bit more favorable in terms of the wetlands.
It's pretty close in terms of like lateral distance to the edge of the wetland. They're both right about 50, 54. This one actually, the new one might actually be a little bit closer, but we have the benefit of having a pressure distribution system, which thins out all the effluent over it's a thin veneer over the whole system, right? This relies on gravity. So what often ends up happening is you have water that just sort of puddles and ponds in an area of the leach field. And it just doesn't treat as well. With the pressure distribution, you get much better treatment, so. The lateral distance, vertical separation, we're probably going to gain some. I don't know exactly what the elevation of this system is back here, but vertical distance, we're going to gain a little bit, but we are a little bit closer to, maybe a foot or two to the edge of the wetland.
Because as you said, you're dealing with 100-foot all around.
Yeah, the 100-foot runs almost right up to the property line here, so you really can't get outside of it.
Okay, gotcha.
You keeping the property line setbacks? I see 11 feet. You keeping that setback?
Yeah, so all the other lateral setbacks are met, from the house to the property lines. The only lateral setback that isn't met is the wetland.
Any questions from the board?
No.
Willard,
to me.
without the benefit of seeing the site plan, do you have any specific questions or something you'd like the applicant to speak to?
I don't, I just, I don't have a lot of detail really to ask any meaningful questions. So I'm gonna rely on your judgment there.
When, so when were the applicants proposing to start this work?
They are ready to go right now. They've got a contractor, Speakman Excavating, who's gonna be doing the install. And they're ready to go right now.
One question, can you go back to the front of the house, Erica, just to show that? Both Jay and I have been to the site several times and, it's really the only place for it to go is in the front corner there. There's no other place. It can't go in the back. It can't go to the right where they're gonna lose their driveway. It's the only place they can site it. Jay's discussed that with the engineer several times. It's the only place for it to go. I think they've probably done the best job that, what they can do with these constraints.
Curious
they
how
did-
old the home is. How long has the house been there?
The septic system is 1980.
Mhm.
I'm assuming that was when the house was built, somewhere around there. So, 42 years old, something like that. So it's time for a new septic system for sure.
And it probably wouldn't get built today, the house.
It would, yeah, that would not be a buildable lot. There's a lot of fill there. They clearly, when that house was built, it was just a filled wetland. So, and that's part of the reason the house is sort of bumped up and mounted up a little bit and a raised ranch. So.
Jay, do you have anything to add?
No, I think Bruce said it very well, and I've gone over this several times with ASA. Very limited options here. There really are not. What's in front of you is the best available for this site.
Is there anyone comfortable enough to make a motion based on what you've read and seen tonight?
Sure. Do you list the variances? Okay. You list specifically what is stated in them. So I would move that the Yarmouth Board of Health grant the two variances specified here. Number one being a variance to the minimum vertical separation from 5 feet to 4 feet. And the second variance being the location of the leach field from 100 feet to 54.2 feet from the edge of the wetland.
And
I'll second.
do you want to amend that and say that the work should be done by a certain date? We usually do that.
Sure.
It's usually for 90 days, but they're ready to go right now. So I think that will just be in the regular standard issue letter.
Okay.
Is there a second? Yes, Deborah second.
I seconded.
And
So else for to go.
all those in favor?
Aye.
Aye.
All right.
Opposed?
I'm just gonna abstain, so.
Thank you. Then.
Thank you. I do have one question, of Bruce or Jay. Will you require a certified as-built for this, or you want it just? a certified?
A letter of certification and an as-built by the septic installer.
Okay, right. Good enough.
I think usually the certified as-built would be large, commercial ones that go in. I think this one, you've staked out the location of where the septic is going. I think that's the main thing. So we know we're on the right location.
Okay, good.
Oh. So we're all done. Any chance the people from YSAC come in early or not?
Mr. Chairman, they are here.
Oh, great. Okay, so whoever is, please come forward and just introduce yourself and welcome.
My ribbon?
Please do.
You're going to pin ceremony?
There you go, Annie. Thank you so much.
I have a plastic one. I'll go.
Oh, you already.
Oh, I'm already good. All right. I got the plastic one.
Yeah, you're good.
Danny should be here in about 2 minutes.
Okay.
So I could talk about White Ribbon Day if you'd like first until Danny gets here.
You can go back over it again. We had somebody from Independence House, but maybe from your aspect of it,
Okay.
would be nice.
That's him. Perfect
Hi, Danny.
timing. Come on.
You can put 3 chairs around the table if you want.
All right, nice timing. Okay, so why don't we'll talk about White Ribbon Day just really quickly.
You Annie, just introduce yourself.
Oh, I'm sorry. Yes, I'm Annie Catalano. I'm the victim advocate from the Yarmouth Police Department, for those of you that I have not met before.
Could you speak into the microphone a little bit closer? Thank you.
And good evening, everybody. I'm Danny Rodriguez. I'm the Director of Substance Use Disorder Services at Duffy Health Center and have the privilege of also being a co-chair for the YSAC.
Good evening. Thanks for having us. Lieutenant Cal Bogdan from the Yarmouth Police Department.
He's my special guest tonight. Okay, so White Ribbon Day, I know you guys heard about it a little bit already. So Danny and I are 2 of the people that were on the planning committee this year. And we decided to hold 4 events spread throughout the Cape so that people living in different parts of the Cape have a little bit less traveling to do. And we're hoping to engage as many men in the community of all ages in some really important discussions about ending violence against women and all gender-based violence. So we've got a really good event planned for watching a little bit of a clip of a video by Tony Porter, having small group discussions, larger group discussions, and then hopefully everyone sort of leaving with not only a message, but a way to move forward and a plan to move forward throughout the rest of your day, life, year, whatever it is. Did you want to add anything to it?
The only thing I'll add is it really is around creating a larger discussion about what it means to be a man, toxic masculinity, et cetera. So I think it's a great opportunity for all ages to really reflect on what that means. And the panel of presenters that are going to be at each one of these sites, it's a phenomenal spread. So we're just very lucky this year, as we have been in the past, to have some really great teammates who are going to be a part of the conversation.
And you probably heard this already, but I'll just reiterate, highlight the one in Yarmouth is on Tuesday, March 21st from 6 to 7:30 at the Cultural Center of Cape Cod. And also very exciting this year, after 10 years, we've added the Barnstable County Sheriff's Department as one of our sponsors, which is new this year too. So we're excited about that. Does anybody have any
Is
questions?
this open to anybody,
Absolutely anybody,
any age?
any age. Yep. And it's all free. Anyone else have any questions? Good, okay. So now we're going to talk about YSAC, the plans for the settlement funds. I'm gonna let you handle this because you're overseeing the committee.
So a couple of things just as tack on. So in addition to having the privilege again of being a part of the Yarmouth Substance Awareness Committee, in my role at Duffy Health Center, I'm also one of the co-chairs for the Regional Substance Awareness Committee, the RSAC. So I'm just very happy and we're very grateful for the support that you folks have provided us in looking at how to best utilize obviously the remediation funds that the town of Yarmouth has coming over the next couple of years, as well as trusting in the wonderful group of individuals who represent each particular trade experience on our local committee. So again, just pausing, I'm a social worker at trade, so you're gonna have to deal with me here. Just a moment of gratitude for affording us the ability to be very mindful of how to use these funds. So one of the things, and Annie, please add in as we go, because I can talk for days. But what we have been looking at over the past many years, particularly in the last year or so, is what are our gap areas? What are things that we really want to focus in on? What are initiatives that we can do without funding, with funding, as well as really cultivating a space within YSAC where we have, again, a diverse group of perceptions and lenses to help educate us and educate the work that we're doing. So for folks who may be a little bit unaware or not as privy to kind of the inner workings of the YSAC, we have individuals in the treatment field, we have individuals in harm reduction, we have individuals with lived experience, we have a student presence, we have a little bit of everything. kind of a smorgasbord of, again, lenses to help to, again, cultivate that welcoming environment. So with our remediation funds, step number one is that we're looking at following some of the most basic recommendations that were handed down to us, through BSAS, the Bureau of Substance Addiction Services, which includes how do you engage with other municipalities who also are receiving funds to see if those funds can be combined, creating more intimate and important interventions. So as a team, we have begun a subcommittee with our counterparts in Dennis through their SUDAC to see if there is an ability to kind of put our funds together and to create something a little bit more substantial. That being said, the whole summer was taken up by the YSAC having some pretty lovely conversations about, again, what this could look like, what we have for funding, what are our needs. And we've already started to propose either with or outside of our relationship with the SUDAC, our Dennis counterparts, how to access this funding in an important way. So right now, I think we are looking at harm reduction approaches within our own community, looking at how do we work on prevention and education for our youth here in Yarmouth, as well as continuing to provide access to care, resources, supports through critical time intervention engagements such as Recovery Support Navigator, folks with lived experience, individuals who can help walk folks through the multiple thresholds of, a pathway of recovery, whatever that means to them. So I think that encompasses a lot of it. We're really in kind of the planning stages of what are the physical interventions that we want to pursue, but have a fairly lovely framework of which buckets we want to hit. And the final thing I'll say, and I'll kick it over to Annie for an additional comments, is the YSAC continues to be and wants to be an engaging presence in the community. So as you folks are probably aware, we launched in September a monthly drop-in for community members to be able to come, both whether they are actively using, looking for support, family members, caregivers, loved ones, whomever, as well as an access point for naloxone for individuals who may be looking for that as a resource. So that happens once a month at the Family Table Collaborative. And we have been to a multitude of community-based events, ranging in a whole variety of things from Overdose Awareness Day at the end of August to our local trunk or treat, right? Being able to create a presence as a resource, I think helps to destigmatize what substance use and recovery is, as well as creating lovely points of contact to be, again, an ally to community members here within Yarmouth. Great.
Excellent. So I'll just add a little bit to what Danny said, but over the last 6 months or so, we've really had a lot of lively discussions at YSAC about what to do with this funding and where we want to see it and where we think the biggest needs are. So he obviously mentioned those. I don't want to keep talking about it, but I feel like our group is really excited about all the ways that we can continue to help support the community and our members in all kinds of different ways that before we knew about this money, we probably never would have been able to do. So we're very, again, grateful for that. And most excited about the fact that we recently learned that we don't have to spend this money before June 30th. So that makes a huge difference about what we actually can do with it. So, and as Danny mentioned, right now it's really with our subcommittee who is working on figuring out exactly what we want to be doing and figuring out what next steps we need to take to kind of get there. And then who knows, kind of moving forward, once we start to put a few things into place, what's going to happen in the future. But we continue to be actively discussing this topic at our monthly meetings every month for the last at least 6 months. And I'm sure it will continue to be a topic every month moving forward. Does anybody have any questions about?
By what time do you have to have the funding spent?
I don't think that's been clear, correct, Jay?
No, there isn't. So this is the Johnson & Johnson, we all read about the remediation, the opioid settlement dollars, 15-year dispersal. So it's over a long period of time. Bruce has written several articles for the town meeting will happen on April 25th for the funds have to be accepted at town meeting. Once that's done on April 25th, YSAC will have available to them approximately a little bit north of $55,000. They can be rolled over. We found out that just recently, many times, money is not used, is given back or expires and, it's pulled back. That's not the case here. So many times in grants, if you don't use it by that July, December, by June 30th, it comes back. That's not the case. So been very planned and deliberate. It's given us some time, so we're not rushed in that thinking. But I do have to say they've kind of brushed over this group. I've only been with this group for a year. Public health folks are passionate. This group is incredibly passionate. Wednesday, there are probably approximately either hybrid or in person between 20 and 25 individuals that come together, committed and dedicated to making a difference in improving people's lives. I am stunned. That doesn't happen in every community. It happens here. The police department, the fire department, Duffy and others are there with a commitment to help improve and enhance people's lives, and all in the measure of prevention. It really is remarkable. This doesn't happen in every community. So they're excited that there's an opportunity now to spend these dollars wisely, okay, to leverage them. Many of the Duffy and others are using their own resources to also use preventative measures as well. But there's been an exercise now of being able to use these dollars to spread the message even further. So I hope, these are difficult. These drop-in nights, this one will happen on March 21st. They inch along. Sometimes it's only a half a dozen folks that come in, but that makes a difference. It's already, that inertia has begun here, okay? And that momentum is building. So in the community, there's other things that may happen in the future as far as perhaps a conference. This group will come together and bring some things together, but it's raising awareness of the issue. And it's easy to look the other way on these issues, hunger and homelessness and substance abuse. It's very easy for the community and decision makers to look the other way. This group, YSAC, has not consistently held to the point where, no, we're going to raise awareness. So every meeting, reports are given on opioid overdoses and fentanyl, and to show, because that tells the story. The data tells the story, and Yarmouth has a long history of being able to say, where do we best spend these dollars? So I'm excited. I'm pleased to be part of this group, but it really, to the chairs, they're being very humble and they're not really talking about the work they've done. A lot of work has been done. And quite frankly, Bruce has been there for every step of the way. So really with the three of them leading it and others, certainly the staff at the police department, fire department and other organizations. But there's about to come forward with a lot of good information for individuals. And the community is going to all benefit from that.
Yeah, thank you for mentioning the drop-in night. We have had not huge amounts of people coming, but I think every single person that has come there has gotten what they were looking for, or didn't know what they were looking for, but was given some type of service for whatever they were presently struggling with, or for a loved one. So we've been very successful in meeting everyone's needs. And the more that we advertise and get the word out there, and the more we continue to provide the opportunity for people to come forward and receive that kind of treatment, then I know it's going to be a lot more people.
Yeah, and just explain, say a drop-in night. What does a drop-in night look like? Just so, because I've been there, but
Yeah,
the
so
board to know.
it's at the Family Table Collaborative. So it's sort of just a large open space, and there's tables that kind of go around in a circle, and it's different organizations across the Cape. So places like Gosnold, like Duffy, the Comprehensive Treatment Center in Yarmouth, Aid Support Group, all these different organizations that serve people in recovery in some way or another. They're there, they've got their tablecloths and their pamphlets and everything. And when somebody walks into the building, they are escorted by a recovery support navigator from Duffy, who is just there to kind of show them around, tell them what's going on. And people can just walk around. They can talk to anybody. They can talk to everybody. They can talk to nobody. There's free food. There's free childcare. There's free transportation, trying to figure out all the barriers that somebody may have to prevent them from coming. And we're really trying to make sure we can provide that safe space for them. And YSAC has a table there as well. And we're really just trying to figure out what people need. And oftentimes, usually at least one person each night will want to speak to somebody privately. So one of the recovery support navigators from Duffy will go into a sort of private room off of the main room where they can close the door and have a private conversation. And they're actively on the phone, making calls, getting people into treatment. So it's a really wonderful thing that we have seen sort of evolve
Yeah.
over the last few months.
Really, the group has done a great job to eliminate that stigmatization, and it's very open, welcoming.
Mhm.
The ambiance is there to say, it's just
Yeah.
inviting people in to say, if it's not for themselves, just so that they know in the future that they're able to have their resources here.
Yeah, absolutely.
Bruce, did you have something?
Yeah, I was gonna say you also, the YSAC put on a good event down Smugglers Beach. The National Day. Do you want to just go on that? That was well attended and it's increased every year, and Don's done such a great job down there that it's a focus event of the build off for the year.
Yep. So I'll speak a little bit to that and before I hop onto that, if it's okay, Bruce, I just want to say, I feel like sometimes it feels like Shark Tank where we're here trying to, present and be excited about this product that we're doing and, smoke, just lots of fanfare, et cetera. But it truly isn't about quantity, it's about quality. Right. We've participated as an agency, stepping outside of my, hat of a co-chair here, in other drop-in night events where they have been centralized in certain locations and no one has shown up. Right. So to be in a standalone facility where I think the last one we had, 3 individuals got served. That's incredible. Right. And that's 3 lives that were impacted that would not have been impacted if that resource wasn't there. Right. So again, quality, not quantity. As Bruce had mentioned, YSAC has supported and been a partner for Dawn Roach's overdose awareness event that she holds at Smugglers Beach every year. She started it in remembrance of her son who passed away from a fentanyl overdose a few years back. And it started as an opportunity for her and for other caregivers, loved ones to come and have a space to grieve and to share their stories and celebrate the lives of the folks that they had lost to an opioid overdose. And it has significantly grown over the past couple of years. I would say YSAC's contribution to this event was supporting Dawn and being able to bring resources to the event as well. Right. So before it was kind of a smaller, intimate gathering where families would truly just support themselves. And now there are providers, resources, peer recovery, other peer-based allies who are there to, again, be an add-on to the importance of this event and to be able to field questions, you provide support, again, access to treatment, Narcan, harm reduction materials, et cetera, et cetera. And I think last year there was somewhere around 200 individuals who came to the event, which is incredible. And it kicks off, I think, for the last 2 years, what we have then done as YSAC to bring awareness to education around, Recovery Month, which is September. And usually that's a action-packed month for YSAC.
If I could, Officer, we see it in a spreadsheet. We see the data, the fentanyl, the overdoses, and the Narcan applications. Maybe you could just talk about what a call like that must be to go into a home and have to respond to those types of calls.
Well, it's a very tough call to respond to. We get a lot of those. And over the past 6 or 7 years, we saw a dramatic rise in overdose calls. In the past year or two, we're starting to see that curve, and those calls are starting to go down slightly. Now, whether it be because of the Narcan that's out there and available, that is able to be self-administered by the people that are on scene and they don't have to call the police, that could be one reason. But again, there's a lot more education programs like this, like what YSAC is doing, what Duffy is doing, what Gosnell is doing, which is also decreasing the call volume of the overdose calls. But the overdose calls can be as simple as responding to an unconscious person, and we don't save them. We do every life-saving effort we can, Narcan them, CPR, first aid, everything we can, and we don't save them. To the call where we go, the person has no pulse, not breathing, they're blue. We administer Narcan, maybe a third time, and they come back. And they come back and we save them and we bring them to the hospital. And programs like YSAC, programs like Duffy, programs like Gosnell are there to support them when we do make that great save, and we're able to, and we call it a save. We saved them. We brought them back. They're alive. And have there been victims that we've gone to over and over and over again? Yes. Have we been able to save some of them? Yes. Are there some that are in recovery today because of the efforts that the police department and all the other providers have done? Yes. So it's a hard call to go to. We know you know, when you go to an overdose call, you're either going to one or two things. You're going to, unfortunately, a dead body, or you're going to someone that is in crisis and needs your help as soon as you can get there. And you need to give CPR, you need to give first aid, and you need to, put on your life-saving hat. And so they're hard calls to go to. Everyone is different. Every experience that I've gone to, thankfully I have the lieutenant bars now and I stay behind my desk most of the day, but it wasn't too long ago when I was driving down Townbrook Road and I looked off and against the fence, I saw a young lady. I'm like, ooh, that doesn't seem right. Stopped, and she had overdosed, and she was there, and I was the first time I'd ever used my Narcan, and gave her the Narcan, and the fire department showed up shortly after, and they Narcaned her and brought her back. So they're tough calls. They're not going to go away. The opiate crisis is, I don't think the opioid crisis is on a decline, but I think our responses to some of these calls are because of some of the services that are able to be provided and some of the things that are being distributed out there, Narcan and whatnot. Right.
And if I just may add, Yarmouth is uniquely positioned in a lot of ways, unlike other communities, that the willingness of the police department and fire department to be active participants in these discussions, it's incredible, right? That partnership is beautiful. It cultivates a lot of trust, with our community members, to not see law enforcement as just law enforcement, but, stepping outside of their typical historic quote unquote role. And just to add, the trends that we see, it's not getting better, and it's not the fentanyl, right? There are other substances at play now, right? We have an increasing xylazine issue, which is a tranquilizer that is making it much more difficult to have reversals via Narcan. That's a major issue, and that comes with other medical complications. A bulletin just came out around cocaine and the fact that more and more statistics are coming out in Massachusetts around that being laced with fentanyl. And Duffy is positioned in a sense that we have a teen program, and in our teen program, nicotine cartridges that are not purchased obviously at the store, marijuana, other substances are also being laced at times with fentanyl as well, right? So the risk factors that are present and out there are ever increasing. And one of the really lovely parts that I appreciate about YSAC in comparison to maybe some of the other communities I serve on their substance awareness task forces is it's about action, right? We're done talking about it and we're ready to figure out how to act to better serve our community. And that's through all of the, the presence of all of the members that have obviously their pull and their dedication in their own kind of markets and trades. So we're very lucky there.
I think one other thing is, as the Cal said about bringing them back and getting them services, that we have a unique partnership with Duffy on a recovery navigator that we've had for several years in Yarmouth. I think it's kind of unique on the Cape here. And we're looking to expand that as one of the goals within the money coming forward. But do you want to just go over how that navigator works? And it's a great contract we've had, and I think it's worked out real well.
Yeah, so all worlds bleed together, right? So one of the parts about working with the police department is we work really closely with Annie and other law enforcement individuals to be able to collaborate on cases where overdoses happen, substance use related calls, right? It doesn't have to just be clean cut opioid overdose. Now Duffy's involved. So any information that we receive or referrals from YPD as well as the community, we have a dedicated recovery support navigator, again, person with lived experience who is operating from best practice and trauma-informed lens, who will make outreach calls to those individuals and not just offer treatment, but offer the continuum of care that is available to anyone within our community, whether that be true harm reduction support of how do we get you to the hospital? How do we get you, the ability to use in safety? Or if you're not quite at a stage yet where abstinence or treatment is for you, that's okay. We're here. We're ready to serve you. We'll be here for you at any point in time. But how do we get you to a point where you're safer than you were before, right? Those referrals have yielded relationships with community members where they have gone to treatment. And not only have they gone to treatment, but the recovery support navigator follows them through that treatment, ensures that their transition back into our community is as much of a soft landing as it can be. And we've actually had many Yarmouth residents who have moved into recovery-based programs or housing arrangements in returning back to the community. So it's not a one and done where, you interact with a recovery support navigator, give you a plan and move on. There's a lot of loving, tender care, TLC, tender loving care that goes along with this partnership. And we've seen some really wonderful outcomes. And for the folks that are a little bit more complex, they continue to truck along and to be there for them when they're ready or whatever they need, again, to better their health and wellness. So it's a partnership that we really enjoy.
It's been a great partnership and it's been very helpful, and I'm hoping we can expand the hours with the new grant coming forward.
I was just going to add one more thing. As we recently found out that there's going to be an additional set of settlement funding coming from other companies. So we are, I think, just kind of adding that into the discussions of what we're going to do with the funding we already have. So I just kind of wanted to mention that we're working on, with Bruce, or maybe Jay, applying for receiving that funding.
So the board understood, thank you, Annie. In addition to the J&J dollars for the settlement that has already started to be allocated, there's settlement funding that's coming forward from CVS, Allergan, Walmart, and maybe one other, Walgreens, maybe. Those are in development right now and the specifics aren't available. What's good about those is the dollar amount isn't quite as much, but the dispersal is far shorter, over a 5-year period. So it may in fact come out to a yearly dispersal of about what we're getting with the J&J dollars. So there is funding here. And as Daniel said, now we're at implementation stage. The planning is gone. A lot of the good ideas are there, but now it's ready to be implemented. And that's when it gets exciting because positive results become infectious. And when you start seeing this, we have the data, the tracking is there, and now we have some dollars to actually do something. The frustrating part is when you see the data, but you don't have the resources to do anything about it. Well, that's within reason and within scale, we're going to be able to start doing something. The YSAC group will come collectively to do something. As a Board of Health, we're thrilled that we have this community group, diverse, as Daniel talked about, from all different community partners and resources to do the best thinking subject matter experts together to put this forward. So they've been a tremendous resource for our office.
And I'll end with, as I was going through some of the YSAC files and just what I had on my side there, I found a report that the Board of Selectmen put together, put a little pamphlet together, came out with it, 1969. The town went to town meeting and said they wanted to look at the marijuana and drug issue within the Cape area. And it's a pretty interesting report. Yes, things hasn't changed. They talked about narcotics. One of their solutions was more education for the Mid-Cape area, a treatment facility, and to reach out into the community. So, it's a long effort to towns, and everybody's been addressing it. As Cal said, it's not going to go away. We need to address it the best we can. But it's interesting reading, and I got copies for everybody that I'll provide. It's an interesting look back.
Anyone else?
Annie, Daniel, Carl, thank you so much for being here. Tremendous help. We'll
Thank you
look
for
for
having us.
good things ahead. Thank you.
Thank you for the
It's
opportunity.
spectacular. Thank you.
Yeah, thanks your effort and really congratulations on your success. It's really very impressive. Thank you. Okay, let's work our way down the agenda a little further. Looks like number 5, here's an update on coronavirus. I assume, Jay, that's you?
It is.
Great.
Thank you, Mr. Chairman. I'm gonna run through. This is there's a little contradiction here because what you're seeing in the news and what our data now, we have some very positive news community-wide. As you can see, overall cases since now going on since March of 2020, eight positive cases, nearing nearly 6,000 since the beginning of the outbreak. But these are some of the lowest numbers you're going to see that we've seen since the beginning of January. So there's clearly a positive trend here. Go ahead. Looking back, as you can see, clearly February, the numbers are almost cut in half, 116 to 68 positive for the month of February. And that's certainly a positive trend, and we hope that word is.
Okay, would you go back to that previous slide for a minute, please?
Go right ahead.
That says 65 deaths. I mean, we've been just looking at 4 and then 5 deaths. I mean, how did that jump up like that?
No, this is 65 deaths in total.
This is from 2020.
This is from March of 2020.
I understand that, but I understand. So when we get that report from Phil and he has number of deaths, is that just for that month or that report period?
No, this is a longitudinal look back over so since the beginning, the overall positive cases, 5,866 overall.
Right.
Active cases right now, present day, 8.
Right. I understand all that. I'm just questioning the death certificate piece because I've not seen that high number before, I don't think.
Well, it was 59 a little while ago. No, that has been sadly and tragically inching up, but right now it had been the high 50s up until just recently.
Okay.
But so
Yeah.
that's over the outbreak is 65 for the town of Yarmouth.
We could make a note overall death certificates if that clarifies it, but
No, I understand.
okay.
I understand it. It's just that when I get Phil's report, it's just showing deaths, 5. It's not showing 65 or 25 or 35. So what is that? What is he saying when he gives us that single digit number?
His weekly update. You know, I don't want to go by memory here. I'd have to go back and take a look at it. But if he's giving a number of 4 or 5, that would just be for that period since the last time he has reported. This number is collective.
Okay.
Right.
65 since the outbreak.
And again, that's provided to us by the town clerk, so that the death certificates
I
get,
know some of them are behind and it's catch up.
yeah, and they catch up, but for the people at home, it's whether it's the primary cause or a secondary cause, so they would bring that down to us to add that on, and same with the town clerk brings down any drug cases that might have people have died of fentanyl, so we can keep track of that for YSAC also.
It's also, Mary, anyone has tested positive and dies within a certain period of time, they are counted as a death secondary to COVID, which may not be the primary reason the person passed away. That's just how they do the statistics, I believe.
That's, Mr. Chairman, that's exactly right. It's within 30 days. If you've tested positive within 30 days, it is considered a COVID death. It's put in that aggregate. The calculus includes it as a COVID death.
Okay, thank you.
Okay. Again, the monthly cases significantly being reduced, actually cut in half since January, and hopefully that trend were to continue. So now we're seeing Yarmouth at one of the lowest numbers positivity that we've seen, 7.20. Again, lower. Vast majority of the communities across the Cape are now lower, a few being higher, but you can see the trend going across the Cape. It's certainly going lower, and we're not at the top tier now anymore. So that number is actually almost in half since, like I said, since we'll see that in a later slide. That 7.20 is almost half of what it was at the beginning of January. Our vaccinated, fully vaccinated, I think we just have 1%. We're now at 80%. That number isn't increasing the way you want, but it's holding steady. And secondary vaccines, boosters, again, I think that's about the same that we've seen for quite some time. There may be some reluctance. I don't know what that, we're not seeing vast movement in the vaccinations or booster numbers at all. But our efforts continue. This one here, we're seeing, if you look back left across our board, 15.85 at the beginning of January, and we're now at 7.20 as far as positivity as of March 1st. So there's a significant drop that's going on in the community, whether it's in testing or just it's dissipating. All the efforts matter, I think. So resources, the vaccine finder, we still encouraging folks, the community, if you haven't already and you're looking to, we would strongly encourage you to get vaccinated. It does minimize the severity and shorten the duration of COVID if you were to get that, so that the Vax Finder will give you availability of where that is. It's a state website. On the Cape Hospital, the healthcare Monday through Friday and on Saturday, the number 508-862-7000 to make an appointment, and they're at 27 Park Street in Hyannis. Hopefully residents will take advantage of that, but also locally. Again, you have to register, but at CVS, Stop and Shop on Long Pond, and Walgreens, Bruce and I check them regularly. There's plenty of vaccine available, and would encourage residents to take advantage of that resource. Testing sites, self-testing, we're doing it. We're giving out a good number of tests. So the testing and reporting, although it's dropping, it's truly, I'd call it an artificial number, because most folks, I think, and we don't know what that number is, they're testing at home, but there is testing that can happen. And that's at 25 Communication Way in Hyannis. And
PCR testing,
yes,
not the,
not the rapid at home. Exact. Good, Mary. Thank you. The kits, Bruce and I just walking into this meeting, I think it's whether people are paying a lot of people like to come into the town hall and pay their excise tax, or maybe get their dump sticker, their recycling stickers, but it's almost 100 a day that are going out the door at our front door upstairs. So it's on people's minds, and thankfully they are testing in multiple times. Bruce is very good about making sure people don't walk out with one. They probably walk out with a handful, 3 and 4. We try to encourage that they come because we have the supply. The forward thinking was done to make sure that we have plenty of home test kits, and individuals are taking advantage, residents are taking advantage of that. So the kits are here at the town hall, the senior center, the library, nonprofits, food pantry, pretty much anywhere where there's an intersection with the community, we have COVID kits available. Mask advisory from the board stays in place, going back, I believe it was to May or June 6th of last year. Prudent that, again, it's just another precaution, making sure for self-protection. And this is now the influenza numbers, very much mirror what a typical season would look like. Highest in December, tapering off, and that has been mild. It's been overshadowed by the COVID, but those numbers for March 0, but hopefully downward trend as we pull out of hopefully influenza in the warmer temperatures. Okay, and that's it. And Bruce, I don't know if you want to handle this or not, but contradictory to this positive information, or just supplemental, I will say, is an incident that you've all read about in the paper. And Bruce, do you want to talk about it, or do you want me to?
No, I'll start, and you can give it a little follow-up, but we know one of our nursing homes in town have had an incident over the last week. And, it's unfortunately they've taken precautions, as all the nursing homes had, but they got the COVID came in there and just spread rapidly through the nursing home. 3/4 of the residents were boosted along with the staff that just got in there. Some of them were asymptomatic, so they didn't know they had it as they spread it, whether they're walking the hall or in the dining room or the craft area, or people coming in or their visitors. It just happened to go right through very quickly. I've been in contact daily with the town administrator up there, including the weekend, and touched base with the Department of Public Health on Monday, a couple times during the week, and again today. So they did bring the Department of Public Health Rapid Response Team down to help with nurse staffing, CNA staffing. They brought 15 state people come down for that. That's what they needed. Their kitchen staff was okay. That was a concern that I had a concern whether they could, handle that or not. But that's been fine. So they've been doing everything they can do. They closed the missions for a while based on DPH, response. So they've done everything they can do. And I guess you want to reach out what you heard today from the
Sure. So, Bruce, thank you. And that Bruce has been following this and making sure that the community and the board understands this is completely under the jurisdiction of state DPH, right? And the rapid response team that's in place. We play a very much a supportive role, and what we're doing tonight is a messaging role for the community. But it's a good reminder, and unfortunately alarming, that in fact how communicable this COVID still remains. One of the things that, it's a difficult population. There's a dementia unit there. Very difficult. They, hard for them to perhaps wear a mask. Perhaps hard for them to isolate. They roam a little bit. So there's a lot of interaction that can't be prevented, although they're trying. But since, and I think Bruce said this, since the beginning of February, February 21st, 75 residents and 20 staff at the height. That number has gone down significantly. And again, as Bruce said, some asymptomatic, didn't even know, but they've been on it. And now it's certainly trending. In speaking to the rapid response team, I believe they're going to be leaving on Wednesday of this week. So they'll be in touch, but it is, if it goes beyond that, we'll hear, but it has tailed off enough where it's actually under control, and people are recovering. As Bruce said, many of the people were asymptomatic and just didn't know.
And Bruce, you had said that many of those residents and staff had been vaccinated.
Yes, most of them, at least 3/4 have been fully boosted. So, and we're seeing that across the community, though, that people that are, even though they're fully boosted, they're coming down with symptoms. A lot of them are a lot mild and a lot shorter. But obviously when you're, elderly and you might have secondary symptoms, you have other medical issues, it can be very difficult for people. And we're also seeing people that have had COVID getting it a second time. So, it's out there, the town demographics of a, elderly population. We still need to take concerns if you have underlying conditions yourself or other family members.
If I could, just for listeners at home, the point of contact it's Lisa Gaudette, and she is she's vice president for communication and business development. I'd just like to give her number if someone listening has a loved one or a staff or a concern, wants more information. She very responsive. Her number is 413-395-7918. We're going to put that information up on our website as well, but to reach out, her number and information is posted on the front door at Windsor Nursing Facility. And she is the point of contact, and then she triages that out to whether it's state DPH or other facilities. And she is the best person as far as communication, and what the board has in front of them came from her today. And every day she has an update of how they're handling this and working synergistically with state DPH.
And the nursing home did reach out last week to residents' contacts. They called them. They have a setup where they can get a regular email or text. And this week, the administrator is going to call each of the people. It's going to call each one contacts and explain what's going on if they have any questions. So I think that's going to give a relief to people that are hearing different things for the newspaper or not. So I think that'll be very helpful, and that's going to start today and probably go all week.
Anything else, Jay?
No, that we'll keep following. We'll obviously keep following our community-wide numbers, but in specifically the Windsor nursing facility, we'll follow that, but it's certainly trending in a positive direction.
And I think the challenging thing is, for us, public health wise, they're doing a lot of the rapid tests over there, all the nursing homes. So those tests, like everybody else's, as Jay mentioned, we're going through at least 100 tests per day at town hall that aren't recorded, that these tests that they're doing at the nursing homes will not show up in our positive numbers because they weren't done at PCR or a hospital or medical. So even though we have that number of cases, they're not going to show up weekly on either Phil's report or the next Board of Health update.
Jay, can I ask a question? I know in May, a lot of the COVID protections and things that the federal government has done is going away. How do we think that's going to affect the town?
No, I think the personal protection piece, I think we've been able to get the information out. We give out masks. We have a good supply as far as masks, as far as test kits. And it's just going to be due diligence on each individual's part as far as the protections. I really think individuals are with the boosting is still available, the vaccines are still available, personal protection is still available. I think that's going to be enough to protect the individuals.
I guess what I'm asking is, we've been getting tests pretty regularly. Is that will that stop after May?
We don't know. We have a very good supply right now there, but that's a great question. Is that still going to be available? To be determined, but we have not nearly exhausted our supply.
Oh, no, I've seen it.
Yeah.
It's a good one. I'm just curious what it might look like in May when
Right.
some of the things that we
It's a possibility.
enjoying for the last few years.
Yeah,
It's a possibility the state's going to decrease the availability of them to the towns. So we've been trying to load up as much as we can. We're probably just distributed over 30,000 in the last year or so. But I think that number may be decreasing statewide and nationally.
we never say no. When we have an opportunity, a pallet, we order. A
Oh,
pallet.
no, I mean,
And-
keep ordering up until
we
you
do.
can't.
Yeah, we.
The other thing that has come up is whether or not the vaccines would be available, how available they would be by cost, individual people
Right.
having to pay for them or what, and, compounding that is that part of this emergency declaration going away, the Medicaid recipients that were able to get Medicaid because of the circumstances of the pandemic, have to re-enroll. And apparently people had to do that before every year, but it wasn't enforced during the pandemic. So, there's some financial things going on too
Yeah.
that
Mhm.
concern people in terms of vaccine availability and insurance and that kind of thing.
Those are that information as far as vaccine availability and maybe testing availability. We just don't have that just yet. We don't have that.
Anyone else? Okay, next item, number 6 here is discussion of open meeting law, state proposal and a vote. This was interesting document. I wasn't aware of all this going on. Basically, on the packet was a letter from the town of Granby, the Board of Health to Governor Healy. And the letter basically is saying that once again, the people of Massachusetts are about to lose an extremely powerful provision of the modifications to the open meeting law, the ability to meet remotely. As with last year, our board, they were saying, is requesting that you lead and support the effort to allow remote meetings to continue. Interesting. I guess I would have come in tonight sick, which would have not
Right,
been a
we're
good
not-
idea. and just spread whatever virus I have all over. So it's, yeah, I think things have changed. There are more and more meetings and offices that are running with remote meetings, and in fact visits with clinical people, medically. So I was surprised that this was going to disappear. It all came about, of course, because of the pandemic, and we were encouraging everyone to stay home, which I think was the correct thing to do at the time. So people have any thoughts about this? It was a surprise to me. I didn't know this. We were about to possibly lose, I guess, the right to have remote meetings certainly for the Board of Health.
Well, it had already been renewed once. It had come up to expire previously, and the state legislature had extended it. So I guess this is now probably the final time. I personally would support as a board, showing that we also support the possibility of remote meetings. And you're a prime example, Hillard, because you're able to be with us and share the meeting, even though you're not well enough to be around us because you're probably infectious. And I also have been sitting in meetings at home when I would not have come into a public setting with, the cold that I got finally this last winter, or, just not feeling well in general. So that's my personal feeling, that we would definitely support the continuation of the possibility of having remote meetings.
Yeah, I agree with Mary, and also I think it's important to provide the public with another avenue of joining meetings if they don't have transportation or they're homesick, or we don't have anyone tonight, but we've had people in the past join us from that woman that joined us from the company, the element.
To Boston.
Yeah, she was like in Boston, so saves her the drive coming here, and yet we still can get the information. So I think it's great to be able to continue a hybrid, and I'd certainly support a letter to the governor communicating that.
Charlie, Eric, what do you think about this?
I agree.
Well,
Charlie?
what?
I agree.
We need a
Okay, so
motion?
yeah,
I move we send, I suppose we could send the same letter. I move we send a letter to Governor Healy, communicating that our desire to continue to offer hybrid meetings.
Second.
okay, so let's take a vote. I'll go first. I'm certainly voting in favor of it. Deborah, Mary,
Aye.
Eric,
Aye.
okay, Charlie?
Aye.
Okay, so that's unanimous. Now, Bruce, does that mean a letter needs to be formed and then, I guess, signed by the board?
I think you could sign it as chairman. They would have to, a new letter would have to be drafted, and you could sign it as chairman on behalf of the board.
That's fine. So I can, we can talk about that then. That's fine. We'll make that happen. So board members, great. Once again, I'm surprised this was even going to be an issue. So I was surprised to find it in the packet. Okay, next item is the discussion of wastewater information. Now, I know at our next meeting, there'll be a formal presentation to us, and hopefully some people at home listening will learn about what this plan is, what it's about, just the whole wastewater plan. So, Bruce, what is on the agenda for us to do tonight? Is there something specific that should be discussed, or?
Well, I think Jay can kind of lay out the format that's being developed over the next month for the wastewater committee. What will the Board of Health will need to vote on in the upcoming meetings. You probably have two meetings before town meeting on the April 25th.
Okay,
And I think we have some questions and answers that we've seen from Chatham and Orleans Board of Health and Air packet that will need to be addressed, but I think Jay can tell you what the this upcoming month will look like.
Sure.
okay, Jay, you're on. Perfect.
So what's included here is just to begin the board, for the board to start understanding what some other communities have done. Chatham and Orleans, they are further along in this process for wastewater. And where the Board of Health intersects with this is the connection for residents to connect to the wastewater system. So what are those questions? Do they have to connect? We'll work closely working closely with DPW, but what is the process for, as we had here tonight, a septic system? What would be the process for individuals or the obligation even for them to connect to the wastewater, which will be starting hopefully within the next year? It's going to town meeting on the 25th for funding. Hopefully receives a green light there, and the design is moving along. Where the Board of Health intersects is the actual connection for residents to connect to the system at large. But the documents you have in front of you here are to begin looking at what some samples from either frequently asked questions or what some other communities have done, obligations for residents to connect. Just want you to start understanding and looking through this. Then these are going to have to be tailored down for Yarmouth. On the 20th of March at our next meeting, DPW will be here, and maybe the town administrator, I'm not sure, to give a presentation so you see the overall view of wastewater and how that's going to roll out. Simultaneously, the board will come together and we'll have frequently asked questions and residents' obligations as far as what that process will look like, cost and otherwise, time frame, how long do they have to connect to the system? Those have to be defined within this. This really is just foreshadowing what for the board to look at over the next probably several weeks. Just start looking at it, and then we'll start tailoring those to Yarmouth.
So what is the timeline for having that policy developed?
Well, on the 20th, I would say probably within the next month,
So it would be after the town meeting,
before the town meeting,
for the town meeting.
where that would be probably the beginning part of April. We would have this ready, because that will come up as far as question. Does it have to be definitive? Probably not, but we should have some strong guidelines as to what direction that's going. How long? Someone just put in their septic system
Oh.
2 years, 3 years ago. What's their obligation? What's the leniency there? What is their terms like betterment? And okay, what's the financial obligation? How does that get paid? How is that deferred?
Has the town decided that yet? If it's
Those
gonna
are,
be-
you're going to hear about that in the process.
Whether
Yes,
it's going to be a betterment or tax.
there is no tax. This is not going onto the tax roll.
No,
No.
it said it was not going to be,
So then
that, but
it's-
there will be expense to the homeowner.
Exactly. There is financial, and that will vary, Mary, that, you're going to read in some of this Chatham and Orleans, it varies. It varies as much. It could be as little depending upon the geography and the elevations as $5,000 to $30,000. Well, we're not going to do that. We don't want to even set that expectation yet. We have to define what this is going to look like, what the obligation, and more than anything, the time frame. But on the 20th of March, you're going to have a comprehensive overview of the wastewater plan for the town of Yarmouth. But I would very much encourage you and ask you if you could to start looking through this and some thoughts of how you'd want this to how the board would want to bring a policy together.
I read Chatham's. I thought it was excellent.
There's a lot, we don't have to start from scratch here by any means.
Yeah.
We have a lot of good things.
Chatham's is excellent. Orleans is very thorough. It's over 60 something pages. And the town's working on something similar now, DPW, to boil it down to include a lot of the Q&A for health departments. So I think you're going to see a lot of that. And I think you're just going to be voting on a few things as they come, like, when you want to connect, then you just have to fill your old system in. You don't have to, or you can remove it. It would be your choice. You can probably fill it in. There'll be enough dirt on the property when they dig the new sewer line. They can fill it in at that time. So it's questions like that that the board needs to be prepared for. And I think looking at Orleans, And then Chatham will be easy to come up with some policies over the next month. Hilliard will, of course, we have different demographics than Orleans and Chatham, which is going to make a lot of difference, and that's the age category and financial category. So I think that needs to be given consideration. That it's going to be financial for a lot of people, so we need to make it as helpful as we can. And at town meeting, Hilliard will be, speaking on behalf of the board, and Hilliard's attended the last couple wastewater meetings and being prepared if there's a small statement on behalf of the board, what direction the board's taking.
And we have this March 1st, 2006 letter to the then DPW director, because back then there was anticipation that there might be sewerage on 28 that didn't go through. And I was at that town meeting when it didn't. This was how that board felt in terms of timelines and all. But after we have our meeting next time and hear about the overall plan, some of this, wouldn't go. I mean, wouldn't work now for what we're doing.
Correct. And I think that's what the board has to look like, discuss, and, it might not be 5 years for hookup after you put your system in, it might be 2 years. And I think that's what you're saying. And there's also a provision for potential hardships, which is difficult, but they haven't seen a lot of them in the other towns. So, but again, the demographics are different. So I think that's the question the board will have. Obviously, DPW wants everybody to sign up as quick as possible because it's going through. And I think probably the most important thing that we're talking about tonight for wastewater and town meeting come up is people need to vote for it.
Yes.
Even if you're not in the first phase, we need to build the treatment plant now. We can't wait because it's going to cost more, and the state might be requiring alternative systems or something else, but it's important. I think as everybody's listening and board members, I think we need to encourage people to come to town meeting, even if they're not in the first phase where they're going to get hooked up. We need to start building the treatment plant now. First phases will be going through, 28 to get the business community, and then we'll be reaching out. But it's important to get people to vote.
And
There'll be some outreach, I believe, still scheduled on a communication team.
There is, the town administrator has a whole communications team and consultant bringing that together, and there'll be an informational campaign that's going to be rolling forward probably over the next couple of weeks. But one thing to remind on hardship, and I do understand that piece, but the problem doesn't get solved unless people hook up. We have an environment, this whole effort is about a solution, right? To improve the environment. And we need participation, and there's a mechanism to help individuals with the financial barrier. But how we solve this, and there isn't another option, is we need individuals, residents to hook up to the system.
the other thing I wanted to point out is that this Phase 1 Futures Group that introduced itself to the Board of Selectmen last September have now come out with this December missive that you've included in our packet. And this group is business and property owners who are very much in support of the waste management plan and who wanted to give input. So I think we really need to take a look at this too, because they're addressing some of these issues that we are going to have to make the policy on.
Bruce, do we have to participate, or are we responsible for making decisions about people closing up their systems, septic systems, whether it's removal, filling in? Do we have to establish a policy for that?
Yes, you will. Once people get, when the sewer line goes through, they'll receive a letter. Most towns it comes from the health department. So we'll be working on that. That will have to be sent out, and that will give the people the time frame that has to be put in. And then within the letter, they will need to take out, it'll mention they have to take out a decommissioning permit. And that can also be issued by the health department, but it can be inspected by DPW when they look at the sewer line hookup. But yes, the Board of Health has to outline the methods of decommissioning, and that would either be by filling it in or removing it. Some people may want to remove it because they might be featuring that in a swimming pool or something, so that might be the time to take it out. Other people might say just fill it in with the sand available. We would not, at this time, we would not require a recorded. It's out.
And I assume there's gotta be some proof that the system's pumped out before all this takes place.
Correct.
Okay, good. Anything else there on wastewater discussion for tonight? No, I guess not. So let's move along. Number 8 here is approval of the minutes. This was from July 18th, 2022. Anyone have any comments? Corrections, edits
This was
on the minutes?
Eric's return. We couldn't prove them until he came back.
Do you remember this meeting, Eric?
I do,
Oh,
I do remember.
Excellent.
If there are none, we needed a vote on this for
I'll make a
approval.
motion to
So-
improve the Board of Health minutes from July 18th, 2022. That meeting was attended by Hillard, myself, and Eric.
Second,
That's great. Any discussion? Hopefully not. That's good. I'm gonna vote for approval. Deborah?
I wasn't there. I can't vote.
Okay, Mary, just gonna go down the line.
Aye.
Eric?
aye.
Charlie?
Aye.
Charlie wasn't there.
No, Charlie was not. So that's why you'll have to abstain. You weren't present, but I appreciate everyone reading it anyway. So that passes. Okay, the minutes have passed. Let's move on to new and old business. I have, yes, one comment. It's more than a comment. I don't know if it's new or old business, but it certainly could start with an announcement here that our leader, Director Murphy is retiring. And really I have mixed feelings in this. I really feel badly I'm not physically present there. This is Bruce's last Board of Health meeting. Bruce came on board. Bruce, 43 years?
Correct.
Yeah. So let's think it's 24 meetings a year times 43. Eric, you were at school most recently, but I'll say it's over 1,000 meetings. That's pretty scary. Bruce, as I know it, you came right from your graduate program. I don't think you even had finished it in public health when you started your position here in Yarmouth. I could say that someone in HR made a very good decision in hiring you. You've been incredibly committed to this town, and the town's been really very, very lucky. I mean, the amount of knowledge you have and how you've used that knowledge about improvement of the environment and just the health of all of us. Town has been so lucky. I don't know anyone who's committed 40 years to a position. I really don't. It's really a compliment to you. You think back in public health. So Bruce, was that in the early 80s that you came on board?
That's correct. 1980.
Okay, early 80s. Let's think back. I mean, around that time, there was a problem where a certain part of the population were dying. Okay, basically, these individuals, as I recall, would come into the emergency department with unusual looking rashes and pneumonia, ended up dying. And we noticed that seemed to be isolated, or seemed to be the majority of the cases were men who had sex with men. No one really knew what it was. And early in the 80s, finally discovered it was a virus. And this was the start of the pandemic, the AIDS pandemic. That's probably where your career started in dealing with public health. You could think, I don't know. Well, we were talking about wastewater. You think back, Ruth, when was it? In the 90s that you were starting out with Title V here, and just is that around the mid-90s or so, Bruce? Title V
That's
showed
correct.
up.
Title V, they had something even before Title V, a state article that addressed it, but then it was updated in the nineties, and it was further updated in, 95 to the Title V septic system, and then we've had a couple revisions since then. So the office spends a considerable amount of time on septic systems.
It's one of the things I'm excited about for the board and for the health department, and that hopefully with wastewater being handled by sewering, that's going to free up some time here in the health department. And what I think how things have changed for you. And I mean, Title V is going to solve all the problems, and obviously it hasn't. If you just look at the water and quality of the water, that wasn't the answer. And it's taken us this long to try to correct it, but I'm certainly optimistic, and it's nice this is finally happening. Bruce, you just know the inner workings of the town so well. It's amazing. I know when I want to know where something is located, I trust you more than Google Maps of where a street is, or a house, or a place to get coffee. You're better than my Waze app that I use to try to locate things. You just know this town so well. I can tell you, on a personal level, I think you and I saw things in a very common fashion, just in sense of priorities in town. And that it's been a gift for me in sense of, I think, working very efficiently with you because of just what our thinking has been for the health of people here in town. Most recently, I guess, it's dealing with the pandemic. We've spent hundreds of hours together. I think we've learned a lot, and I think we've provided certainly the Board of Health with the health department in helping this in this awful period of time with this pandemic. It's I personally just wish you well next phase of your life, and I hope to see you in the back roads cycling, and I'll join you in riding in the back roads here, bicycling around. Maybe I'll stop here, and if there are other board members with some comments, it's just a big moment. It's a very emotional one for me. I can imagine what it is for you, Bruce, but just thank you very much.
I mean, I'm going to just echo what Hillard said, because I think we could all go on about Bruce for, next couple hours. I know I could. I remember when I first moved here, I lived in the city. A septic system. I didn't even know what that was. I was like, what do you mean? Septic system? Somebody doesn't come pick up my trash. Like, I remembered. And when I first joined the board, there's so much I didn't know. And Bruce was so kind and patient. And I remember I went out he took me out and showed me what a septic system was that was being built. And I could always call him or ask him questions, or, hey, can I come in and chat with you for a little bit? I have, some questions about just anything health related in the town. And it's going to be a tremendous loss for the town and for me. But, and who knew he was better than a GPS app? I mean, I'm learning so much, but we will miss you. And I'm so thankful for the time I've had on the board, just how grateful I am and how much I've learned.
Thank you.
I'm going to cry.
Mr. Chairman, with your indulgence, I'd like to issue a proclamation. This is from the Yarmouth Board of Health. Hear ye, all citizens of Yarmouth and Cape Cod, Massachusetts, take notice. By virtue of the Yarmouth Board of Health's little known and little remembered archaic powers, The aforementioned board hereby designates March sixth, 2023 as Bruce G. Murphy, RS MPH CHO Night at Yarmouth Town Hall. Whereas for some 43 years, Bruce has foregone the restful comfort of Monday evenings at his home to instead rein in the worst impulses and encourage the best actions of the Yarmouth Board of Health members. And whereas he has decided that the time has come for him to retire and abandon the board to a new director yet unknown. And whereas he is giving up breathing and living for public health. And whereas he is leaving behind a dedicated and effective staff to carry on. And whereas every resident has at least 2 COVID test kits. We, the board, excuse him from any further Monday meetings and hereby release him to his family, his bluebirds, his baseball, and his couch, and bid him a well-deserved, happy, healthy, and long retirement.
Thank you. Thank you for those kind words.
And wow, I guess, is there any, sorry, Bruce, any other old and new business?
I'll just say one thing. Thank you for the very kind words. It's very humbling. Thank you. New business, Jay, you want to say what's coming up? I think we have, besides wastewater, you have a couple things you need to put on the next agenda.
I do, thank you. If I could just take a second, piggyback. I've only had a short time to work with Bruce, but I've worked in public health for 30 years. Yarmouth's been well served. Bruce, great job. Congratulations on a wonderful career. Really have done so much beyond public health for this community. Well recognized. The board understands it. They see it each Monday night, but individuals that come to the counter, he knows them by name, helps where he can, instructs, guides individuals far beyond what is required in any code, whether it's in restaurants or hotels and things like that. You've done quite a bit. Quite a resource for the town, well beyond public health, Bruce. I've worked in a number of different communities. To be congratulated, and I think Mary's point of and Hillard's and others, and Deborah. Best of luck in the future. You move on to the next chapter, right? You have many other things and many other talents that you want to move on to, and as you do that, the board and certainly myself, the staff, I can speak for the staff. We wish you the best of luck, but congratulations but thank you for all you've done. So thanks so much. Our next meeting, the board's next meeting will be on the 20th of March. Wastewater will really predominate the meeting. However, there was a tobacco compliance check, not by the Barnstable, not by the contracted group that you have that comes in on a regular basis, but MHOA federal came in and did a compliance check, and there were some individuals, although there's no jurisdiction as far as punitive. We do have some individuals we'd like to bring in very quickly, probably before the wastewater, to come in and have so that we can give an educational opportunity for the board or two establishments that sold when and they were in violation of the tobacco regulations. Okay.
They'll both just be warnings because they're federally done, so we can't find them, but they have to, as they've come in the past, say what steps they're going to take, and one of them already been recently to us.
And then one of the things also is it piggybacks on what you'll be doing as far as homeowner and connection. I do want to talk just quickly as far as the affordability, the septic system upgrades and replacements, some through the Barnstable County office, some of the homeowner assistance that's available. So we're going to give you information on that as well. The financial barrier that comes with septic. 2 small pieces, but the vast majority of the 20th meeting will be on wastewater. I think it's going to be very educational for the board. A lot of work has gone in. Not only is it operational, but it's also financial, right? Over $200 million. The town administrator and the assistant town administrator have to be congratulated. There's a very stable funding source for this. When you look at that pie chart, it's 10 individual sources, so that's hard to tip over. This isn't one federal grant. This is very stable and well coordinated, and the implementation and operationally. I think you're gonna be very impressed. I know you will be very impressed. We meet in this room on a weekly basis with a lot of input with consultants and otherwise, but this is very thoughtful, strategic plan, and more than anything, it's going to improve the environment. Doing nothing is not an option, right? It's doing nothing is not an option here. And there's a lot of financial benefit, a lot of environmental benefits, certainly for public health, and financial benefits for homeowners and businesses as well. So
Whatever you can provide in the package would be great, just for us to self-educate ourselves a little bit. I think we'll have better questions to ask, and I think it'll be more productive. So whatever you can provide for us to read ahead of time would be wonderful. I appreciate it.
Mr. Chairman, I will do that. I not only have the slideshow that you'll be seeing, but there's some backup information that may drill down a little further so that you can
Great.
have some questions.
Any other new or old business? Well, we've reached item number 10. If you look at your agenda, anyone want to act upon that?
I move we adjourn.
We have a second on that. Any discussion? I'm sure there's not. So let's vote on voting for it. Okay, Deborah.
It's hard to say, but I'm gonna say yay.
Yeah, okay, Mary,
Aye.
Eric,
Yes.
Charlie. Charlie?
Yes.
It's a yay, that's perfect. Okay, it's unanimous. We're adjourning. Thank you, everyone. Stay healthy. Okay, be well.
Thank you for your service,
Sure.
Bruce.
Hope you feel
Feel better.
better.
Thank you.
Oh. Yeah, sure. Bruce, if there's gonna be a little